Hi, I'm Gino Santorio, your president and CEO here at Broward Health. I had the pleasure yesterday of getting to round with some of our frontline caregivers, security, ICU nurses, EVS staff, and got to hear some of your concerns, gratitude, what you thought was working, what you thought we could be doing better, and I want you to know I heard each and every one of you. As a result of that, today, I convened a team of clinical experts to be able to speak to each and every one of you through this video so that every employee here throughout the organization and beyond can hear some of the things that we're doing.
To protect our caregivers, we have gone through unprecedented efforts in following the CDC guidelines and the Department of Health through evidence-based provision of personal protective equipment when it's really needed the most. This is in an effort to protect our caregivers in an ongoing basis and the patients that we serve.
The CDC recently had modified their criteria, as most respiratory viruses are droplet rather than aerosolized, airborne organisms. They have modified it, and as such, the use of N95 over surgical mask is not necessary.
So there is some confusion about COVID-19's classification. The World Health Organization has classified this as a droplet precaution from its outset. The CDC has gone to its lengths in classifying it, since it's a novel coronavirus, classifying it as an airborne and droplet precautions. And that's why you see some of the patients that we have that are in negative pressure rooms. But if you look at the CDC guidance, it talks about really reserving negative pressure rooms for those aerosol generated procedures. The rest of the patients, all the PUIs that we have, even patients that are COVID-19 positive, those patients who are not likely to participate in an aerosol generating procedure, those patients can be in their own room with a surgical face mask.
So if you're a caregiver and you're within 3 feet of a coughing patient, we do say you should be wearing an N95. Or if you're doing a procedure that can cause violent coughing, such as trach care, suctioning, intubation, you're gonna wanna have your N95 and your PPEs donned appropriately. However, all of the research at this point and all the guidance we're receiving from the CDC and World Health Organization say that surgical masks are appropriate outside of those instances.
The World Health Organization also refers to droplet precautions with this virus as well. So we are just consistent with what's going on throughout the world.
If the healthcare provider is not within a 3-foot radius of the patient and is not doing an aerosol generating procedure, then simply a surgical face mask is appropriate for the patient to wear and the provider to wear. If the provider is not going to be even within a 6-foot radius of the patient, then the provider should really ask themselves whether they even need to enter the room in the first place.
I'm really proud. On March 19th, Broward Health launched our drive-through COVID-19 testing site. We did that in an effort to reduce exposure to our physicians and their office staff, and also to protect against unnecessary surge to our emergency departments.
Rapid test turnaround is crucial in this process, not only to preserve the personal protective equipment, but also to turn over that room that the patient may be in and classify that patient appropriately as to whether they're positive or negative with respect to the coronavirus. We are encouraged that the FDA just approved a test that we can use in-house at Broward, and we're working with the Department of Emergency Management in order to get that here as soon as possible.
Broward Health is prepared for surge capacity. Every facility has a well-executed plan. And beyond that, remember that we're testing over 300 patients a day at our drive-through testing site to prevent those patients from presenting to the wrong access points for care. And our emergency departments are also testing outside of the facilities so that those patients don't present to the facilities.
Being on the front line, like all of you, we have gone through epidemics before. We've gotten through these before. I do appreciate your professionalism and your expertise, and we all will get through this together.
Thank you. From the emergency room triage nurse, to the registrar, to patient access, to the people that triage patients over the phone, we will get over this working together as a team.
Above all else that I do at Broward Health, I'm a registered nurse. I'm also a wife, and I'm also a mom, and I'm proud to be a registered nurse. Every day we're on the front lines. This is a calling to all nurses, our CNAs, our respiratory therapists, our frontline registration teams, our EVS professionals. We are called on the front lines when the rest of the nation is scared most. Thank you for all you do. We are going to get through this. We are going to come out on the other side, and we are going to be a stronger Broward Health family.
So as you heard here today from our clinical experts, every decision that we make is based on evidence-based guidance with you and your safety as the front priority for those decisions. I'm working tirelessly, day and night, with our local, state, and federal officials to make sure that we can continue to provide that care for the community, and the safety of you is paramount in each of those decisions. I will be here working 110% behind you. I have your backs on this, I hear you, and we're gonna get through this together.